And you look at those curves, they're all going up at an alarming rate. So in the new battlefield, hospital capacity is the top concern, period. It's about hospital beds, it's about ICU, and it's about having enough staff and enough equipment. Every hospital has to identify retired nurses and doctors now. We're already experiencing staff shortages. Staff just gets exhausted after a while. They've had a horrendous year. To now go through this again with emergency rooms and a high number of COVID patients coming in. The individual hospital network load balancing is mandated as of today. They are systems unto themselves, and they can have 7, 8, 10, 11, 30 hospitals in their system. It is mandatory as of today that they balance the load within their system. Forget how you operate. This is a mandate from the State Department of Health. You must distribute patients across your system so one hospital does not get overwhelmed. Vaccinations, that is going to be the weapon. That is going to be the weapon that will end the war. But the vaccine critical mass is still months away. And until the vaccine hits critical mass, keep operating at the maximum safe level. We want the economy open. We want people working at the maximum level that is safe.
Reopening our schools next week. Today, we are going to focus on the thing we need the most to get us through to the vaccine, and that's testing. Testing from the very beginning has been the core to every effective strategy. And testing is what we are doubling down on now in New York City. We have the highest testing capacity we've ever had since the coronavirus began. And to make it easier, we have more and more health and hospitals testing locations, more mobile sites that we're moving around. 25 new locations opened in the last week. We're continuing to make it easier. One of the things I've heard from so many people is they really want to get tested, but they're concerned about long lines and the turnaround time for the tests. Well, again, at our public hospitals and clinics and mobile sites, the health and hospital sites have been really good about quick turnaround times and providing people great service. But we do want to address the wait time, so now H&H will be posting updates 3 times a day on Twitter. You can follow at NYC Health System and get updates about each site, and it will direct people to where the waits are the least, so you can go to the place that works best for you. Also, later today, there'll be a new online tool, testandtrace.nyc, will give you wait time updates at 51 health and hospital sites, so you can really plan carefully where you want to go get tested.